Good afternoon and welcome to the webinar entitled Everyone Counts and Everyone Should Be Counted, the 2020 Census and Why It Matters. This webinar is being sponsored by the National Healthcare for the Homeless Council and the National Community Action Partnership. First, for a few housekeeping notes. If you are having any technical assistance issues, please call Caroline at the number listed, and the extension is 222. The number is also given in the Q&A section of the chat box. So if you're having any type of difficulty, please call Caroline at this number and extension 222. This is a 60-minute webinar. We will reserve about 15 minutes at the end of the webinar, but we will also take the time to have questions interjected through the presentation. So we would like for this to be as interactive as possible. So as our presenter is giving you information, if you have a question that pops in your mind, or if you have the need for her to be more descriptive on a certain point, please type your question or asking for more explanation in the chat box and where it says Q&A, and we will be happy to stop at that point, ask your question, and then give the opportunity for more explanation during that time. The webinar is being recorded, and it will be archived about in 3 days on the Council's website, which is www.nhchc.org. And so as we move forward, this is our presenter, who is Lindsay Marsh. We want to just welcome Lindsay for taking the time out of her busy schedule. You know, everyone is being just very, very busy these days with the COVID-19 virus and crisis. And so we want to just welcome you and thank you again for joining us. And we know that with everything going on, we don't want to lose sight of this most important topic of the census. And so Lindsay has been gracious to present today on this topic. And she is a senior associate at the National Community Action Partnership, also called the Partnership. And Lindsay serves as the Consensus Director. Her team works to equip over 1,000 community action agencies, 50 state and regional associations, and 4 national partner organizations to engage the hard-to-count populations that serve with the census and to increase participation. Lindsay comes to the partnership from the Office of Community Service at the U.S. Department of Health and Human Services. Prior to that, she worked all across the country on issues and political campaigns, organizing data research and fundraising. Long an advocate of civic and social engagement, the Census Project combines Lindsay's extensive organizing skills with the real-world efforts that the census brings to the population that the Community Action Network serves. She holds a bachelor's degree in international affairs and a master's degree in political management, both from the George Washington University, and Lindsay is based remotely in Denver, Colorado. So before Lindsay starts her presentation, just want to show some of the learning objectives that we hope that will be met by this presentation. We really want to increase your understanding of why the census is conducted and how important it is for everyone to participate in the census, to explain the various methods how people experiencing homelessness may participate in the census, and also to discuss solutions to many of the challenges and barriers that may impede people who are unstably housed from participating in the 2020 census. So without further ado, I'd like to introduce you now to Lindsay Marsh. Lindsay?
Thank you, Darlene, and thank you everyone for joining us today. I'm doing slightly a shorter presentation today than I normally would do, in part because I want to make sure that you have some time to answer questions, because I know there are questions, especially with everything that COVID-19 is throwing at us. So let us get started. I am going to talk a little bit about what the census is, and why it matters to all of the service providers that touch homeless populations, and the health and housing programs that you folks run. And I'm going to talk a little bit about what you can do to help us in this crucial count that happens every decade. And then we'll talk about next steps and answer questions. I'm going to reiterate that the bottom right-hand corner has that Q&A. As things come to you, please ask. There are no bad questions. There are no dumb questions. If you have a question, chances are someone else has that question too. So please make good use of that Q&A, and we'll stop and answer those questions as we go. So let's just dig right in. What is the census? The census is something that we do every 10 years. It's codified in the Constitution. It's Article 1, Section 2, so it's pretty early in the Constitution. And it was a method that our founding fathers developed to ensure that all of our states equally shared fiscal burdens, be it debt from war, and that started with the Revolutionary War, and also assets. Today we use it for a variety of purposes that are basic building blocks of our democracy. But it is actually codified in the Constitution. We've been doing it every year since every 10 years since 1790. And it's something where we count every person who lives in the United States, regardless of their status. So we count asylum seekers who are housed somewhere in a detention facility in the United States. We count people who are incarcerated in a federal penitentiary. We count diplomats who live in Washington, D.C. We count the foreign exchange student that's been living with you for 6 months. We count military service personnel who are serving overseas. We do not count expats, so American citizens who live abroad. We do not count because they do not live in our cities and towns, and they are not taking resources from our cities and towns. But we do otherwise count undocumented immigrants, American citizens equally. If you live in the United States, we want you to be counted during this process. These are the actual census questions. There's been a lot in the news about what questions will and will not be on the census. This is it. There's also a lot of confusion over the short form versus the long form. In 2000, for that census, they had 2 forms. One of them was short like this. The other one was a lot more intensive with questions like, how do you commute to work? And how many months did you work in the last year? And how many weeks? And how much did you make? All of those questions have been moved to something called the American Community Survey, which is done on a rolling basis. Now, every year, about 1% of the population gets that survey, and no household is asked more than once every 5 years. But that's to give us a rounder snapshot picture of our country, and they went to just the short form for the decennial census. So these are the questions. Everyone will be asked how old each household member is, and what their date of birth is, what their name is, if there's a Hispanic origin, race, and I know race is hitting the news a lot now that the census forms have been coming out, because they're trying to gain more information about countries of origin for the American makeup. So, for example, I am English and German, and so I will put white on my form, and then there will be a drop-down menu where it'll ask me to say a little bit more about where I'm from. And so I will put England and Germany because that's my ancestry. They're doing that just to get a better snapshot of America. They will also be asking relationships. So person 1 is the person filling out the form. So they will be asking how each person on that form is related to person 1. Is it a roommate? Is it a child? Is it a grandchild? Is it a foster child? Is it a spouse, same-sex spouse, or heterosexual relationship? Those things are asked. Gender, male or female. Tenure, is the house, apartment, or mobile home owned or rented? And then they have a few operational questions, and these are simply designed to make sure that you are getting at the full spectrum of who's living in that house or that home. So is anyone else staying here? Some of our populations that we're discussing today, homeless populations, it could be a couch surfer, staying with family friends, or in the communities that the Community Action Partnership network usually deals with, we often have high mobility, people who lose their job, they get evicted, they stay with family for a few weeks, they end up wearing out their welcome, they stay with another family friend for a few weeks, they end up in a motel. So homelessness obviously encompasses lots of different things. So those people are harder to track and harder to count. But one of the ways to do that is for us to reach out to people who are housing such folks and make sure that they're included on their census form. If somebody doesn't have another domicile and they are staying with you, they technically live with you and should be counted in your house. And finally, and this is actually becoming more and more relevant in the age of COVID, they want the telephone number and the name of the person filling out the census form. Traditionally, it's person one, but they want to make sure that they can reach you. They do quality assurance checks, and if you put down under that race, you can, if you put down that you're a purple unicorn, the Census Bureau will probably call and check on that. So in the age of COVID, where we're not asking people to go to the doors as much as we were before, that might be a very crucial tool for us to clarify information. So I mentioned questions that the census, that have been swirling around the census survey. These are the things that will not be asked on the census. Social security numbers, bank credit card information, citizenship status, and I've couched that in here particularly because all of our research shows that if you just talk about the citizenship question, then you're raising the profile of it and you're raising fear. But if you couch it in all these other things that won't be on that form, it slips in and the message gets through, but it doesn't raise people's alarm bells. So anything political, they won't ask for donations. They're not going to ask for household income. None of those things will be on the census. It will just be on the 10 questions on the previous slide. Okay, so once we have all this data, what do we do with it? Once we finish counting everyone in America, the first thing they do is apportion. There are some states that do not have the population to trigger an automatic seat in Congress. They are allotted a seat in Congress regardless, so every state has at least one member of the House of Representatives in Washington, D.C. So apportionment is where you count everyone in America, you divide it up by 435 because that's the number of seats in the House, and that determines how many people will be in each congressional district. Right now, the number is around 720,000. The guesstimate is that the new number will be about 810,000. And so that means that you need to have 810,000 people to gain a second seat in the House of Representatives. So Delaware does not have that number. They will not be getting a second seat in Congress. Wyoming also does not have that number. They will get their one, but they will not get additional ones. Where I live in Denver, Colorado, we have an influx of people moving here. And so we are likely to have grown 810,000 people since 2010, and we will be allotted another member of the House of Representatives. The map for where that shift is going to happen is largely our population is shifting and increasing in the south and the west along the border, and it is decreasing in the northeast and along the Canadian border. So Minnesota, Massachusetts, New York, Pennsylvania, Ohio all stand to lose seats, and several of those states lost congressional seats the last time around. Florida, North Carolina, Louisiana, Texas, Arizona, New Mexico, California, Colorado, and Idaho all stand to gain seats this year. And this is important because it means your voice and your representation in Congress. And so one of the things we're trying to make sure is that homeless populations have a voice in Congress. When they are missed, then they miss out on that crucial voice and having an advocate for them in Washington, D.C. The apportionment doesn't just happen for federal races. It will also happen in each state house and each state senate where that apportionment happens. So the state houses and state senates will be jiggled a little bit too. Once we apportion, we will do redistricting. So when we talked about COVID-19, I'll talk about some of the things that the Census Bureau is thinking about changing for operations this year. Some things are set in stone. Redistricting happens the first year of the decade. So in 2021, we need to do this redistricting process where we redistribute how things work. So case in point, in 2010, Pennsylvania went into the census having 19 districts. They lost population, they lost a congressional seat. So in 2011, they redrew all of those districts because they needed to take that 19th seat and spread it out over the remaining 18 seats to make sure that everyone in the state had representation. So that redistricting process happens, again, on the federal level, on the state level. It also happens in voter districts, and it happens in, say, school districts. So my parents live here in Denver, and the neighborhood that they live in is 3 years old. And so they might have a shift in where those school district lines are because their neighborhood has a lot of young kids, and it might be that they need to rejigger some things so one school doesn't sit half empty and one school isn't overflowed. So that's one of the things that we do with redrawing and redistricting. Distribute federal dollars. This is the other big key piece of all of this. For every person counted in America, your community will receive about $2,000 in federal program funding. So the census count truly distributes those federal dollars in a way that a lot of people don't realize. Many people think that politicians decide where they're going to send the money and how they're going to send the money. And in some ways, they set the formulas, but if any of you have heard of, like, the LIHEAP has an old formula and a new formula, that's low-income home energy assistance program. Those folks have these massive formulas that they calculate how much LIHEAP money each state gets. And at the core of that, you'll find the census numbers. And it happens throughout a lot of the programs that touch our populations. Census data is also used to inform government planning. Where do you put a new fire station? Where do you put, on the local level, where do you put investments in highway transportation funding? On the federal level and on the local level, you see a lot of that. Some city councils use census data to determine how a law or a bill will affect the population. You also see our community action agencies do some community needs assessments every 3 years, and the basis of those numbers tend to be census numbers. So if we get that count wrong, the effects literally ripple throughout the entire country. Organizational decisions. Again, my neighborhood's relatively new. We have a lot of kids where the family house is, and I would not be surprised to see a couple more ice cream shops pop up because they've looked at that data and seen where those kids live. So things like that happen on a regular basis. The Amazon decided to put their new headquarters in New York or in Alexandria based on where those census numbers said infrastructure and people lived enough to fill those offices and the like. The last thing the census data is used for along this list is enforcing voting rights and civil rights legislation. That's one of the reasons why they ask for Hispanic origin and they ask for race. They need to make sure that resources are being sent to areas where people tend to be disenfranchised to make sure that those laws are upheld and fully funded. Before I continue, just a reminder, if you have questions, if I'm not being clear on anything, please put something into the Q&A. Let's talk about dates. So last Thursday was a big day for me. The invitations were dropped, and so people started receiving invitations in the mail. These invitations have a unique online code for households. So they're sent out in waves. So I have gotten not only our census form for our house, but also a follow-up letter already, whereas a friend who lives about 3 miles southeast of here hasn't gotten anything yet. It's coming. If you haven't received something yet, it should arrive by Friday. That's the schedule, and the schedule seems to be holding. Reminder letters and postcards, we got ours on the 15th, so it was a little bit early, but there's a second wave. All of this leads up to April 1st, which is called Census Day. Census Day is the day no matter when you fill out your form, that you refer to as to who lives in your household. So if you have a 24-year-old living with you and she moves out at the end of March and no longer lives with you on April 1st, and you fill out your census form today and you know she's leaving, she should be counted in her new house. That's how that works. We do a census day to erase some of those questions and to make it a little bit easier, and it's a snapshot of America. We know who lived where on April 1st in America. If there is a family that's divorced, shares custody of the kids, technically wherever those kids usually sleep on a Wednesday night, because April 1st is a Wednesday, it should be who counts those kids. Another way to do it is wherever those kids spend more than 51% of their time, or whoever fills out the earned income tax credit for those kids. All of those are good methods. You should probably talk to your partner about the co-parent about that. But I would always rather somebody be overcounted than undercounted. I would always rather that both parents put that kid on that form than neither parent. The Census Bureau can dedupe those records, but they cannot go and make up information that they don't have. So April 1st is an important day because that's the day that a lot of people will respond that day, but also it's the day that we reference when we fill out our forms. Continuing in April, reminder letters will be sent, this time with a paper questionnaire. So the biggest change that's happening this year in the census is that you can now fill out the form online, which is why invitations are being sent to respond online. Every census prior that has had a phone hotline has just been to answer questions. This time, you not only can answer questions, you can also fill the form out online, and over the phones, and they have that in 13 languages. The online system has 59 different languages. I do recognize that that does not cover the vast, it does not encompass all of the languages that are spoken in America, but it does encompass the vast majority. But those invitations being sent are not being sent with the traditional paper form. End of April, that paper questionnaire will arrive at households that have not yet filled out the form to the best of their ability. And then this will be changing, but in the plan, pre-COVID-19 plan, final postcards were supposed to be sent the end of April, and then in May, starting May 4th, non-response follow-up visits were supposed to happen. And we're going to talk about how this is a little bit different for homeless populations and how this is going to be changing. Okay, the census does hire hundreds of thousands of people a cycle. This process is about $15 billion. This is the most extensive operation that the U.S. government undertakes that is non-military ever. It's a big, huge, massive undertaking. And part of that is because in 1970 it cost 16 of today's dollars to count a household, and today it counts it's $107. And again, just to reiterate that, every person counted is worth about $2,000 in funding to that specific community. Let's dive into that a little bit. What's that difference between 16 and 107? I've already mentioned mobile populations, and this impacts our communities, especially when we're talking about homeless populations. Homeless populations move quite a bit, either staying with friends or sleeping on the streets. Here in Denver, people get moved along quite a bit. The no camping ban has been in the news quite a bit. So people are hustled from place to place. So they're hard to find. The constrained fiscal environment refers to how Congress is fighting over how much money to spend on the census. One side of it says, well, we're doing it online now, so it should be less expensive. The other side says rural America doesn't have internet service, so that's an issue. And it's a new technology that we've never employed before. We're going to need to do follow-up. And they are expecting that about 40% of Americans will need follow-up touches and in-person touches, which, again, we'll get to when we talk to COVID a little bit more. The rapidly changing use of technology dovetails with information explosion. For most people, if it doesn't come into your inbox in an email, you might not be checking your mailbox every day, and you might not recognize what's important in the mail. you might think that it's a lending tree mailing because they specifically try to mimic the census and the federal envelopes and the like. The envelopes actually say your response is required by law. It's got the Census Bureau logo and a return address in Indianapolis. No, I'm sorry, it's Jeffersonville, Indiana. And it's well branded, but again, if you've got people who are preying on the look and feel of a census document to get people to open their mail, then it's hard to discern. There is a heightened distrust in government. COVID-19 will likely exacerbate that, which I didn't think was possible. But the partisan bickering and infighting has really made it for a challenging environment. And throwing in the citizenship question politicized the census in ways that it has never been done before, which has caused mistrust and fear on a lot of people. So that makes it really hard for us to convince people to fill out the form. We have an increasingly diverse population. We have immigrants from all over the world, many of whom have never heard of a census. They would never have done a census in their home country because they don't trust the government. So that makes a barrier for us as well. And then we have a lot of informal complex living arrangements. And these are, couch surfers. These are people who are economically squeezed and sharing quarters. You have a lot of people who might be on a Section 8 housing voucher who don't want to put everybody on their form that lives in the house because they don't want to be in danger of losing their benefits. They won't lose their benefits because the Census Bureau does not disseminate that information. But you've got to get that message to folks who are really fearful they're going to lose their home and become homeless. So the environment is really challenging. And the hard-to-count populations, as defined by the Census Bureau, are these: immigrants, multifamily households, homeless populations, frequent movers, low-income, Native Americans, people of color, all of these things, which is a who's who of who our network serves. So it's one of the reasons why we've been involved. Okay, so what does the census have to do with health and homeless populations? I think we've talked about this a little bit. Again, reminder that there's a Q&A. Nobody wants to listen to me talk for a full hour, so please ask me questions. The populations that are the hardest to count and that are the least likely to fill out the census forms are the ones that we work with every day. This is true for any service provider who's doing any kind of anti-poverty work. And we are trusted messengers. We are the folks that can get through and break through the shell that a lot of people take on. I'm not giving the government my information. Why do they need to know that? I don't want the government to know about me. Break through mental disorders and paranoia, those sorts of things, and convince them that that's something that they really need to do. And the populations that we serve are often the most undercounted, which means that we're losing out on our fair share of dollars in representation. And both of those things are crucial to helping the populations that we serve. The census drives dollars. So I mentioned LIHEAP earlier, Head Start, CSBG, which funds all of our community action agencies, health care centers, adult care food programs. All of these dollars are driven by the census numbers behind them. This graph just pushes you a little bit and tells you, hits it home a little bit how much money we're really talking about. $864 billion in total federal program spending is up for grabs. So census funding directly affects the healthcare industry and housing formulas. So again, that formula that we keep going back to, your staff and customers have the most to lose if we don't get that complete count. Kids 0 to 5 are one of the most undercounted groups in the country. It's actually 0 to 4, 5 to 9 is the next one. We missed about 2 million kids last census in 2010. We know that, and it cuts across all demographics. So it's all races, all genders. It really crosses everything in the U.S. And we know that there are lots of kids who experience homelessness. And so if we miss them, We're missing out on child care programs. We're missing out on educational funding. So those kids often go to school, so they have something to do that day so they can get a hot meal. And if we don't count them, we're missing out on that crucial funding. It's one of the reasons why our schools seem to be so chronically underfunded in this country. In many cases, it's because it is, because those kids aren't counted who are living in the shadows. And if you're working with somebody who's experiencing homelessness and you're filling out another form to provide them with services, this is an easy form for us to add on. So we're hoping and asking that you can help us do some of this work by getting these folks counted. I mentioned this before, but one reason that really resonates with this population is that the government doesn't need to know about me. They want to go off the grid. They don't want to be involved in anything governmental, and yet they're also asking for government services. So it's kind of a catch-22. The census has a plan. There are lots and lots of operational plans. If anybody would like some really great bedtime reading, if you have insomnia, you can read through the census plans. But they are interesting, and they are ready for some of this. Again, this is about to change, and we'll get to it when I get to my COVID slide. But transitory locations enumeration, the plan has been for Census Bureau employees to go out in pairs the end of March and through Census Day and count homeless populations where they are. This means going to shelters. This means going to food banks and soup kitchens. This means going down to the creek where people tend to camp over here in Denver and talking to people and counting them. I am not worried about us double counting anyone who belongs to the homeless population whatsoever. If we do, there are 10 more that we missed, guaranteed. So, and it's a shame that we can't use the point-in-time study for this. If anybody wants to talk offline about that, I can address that. But for a variety of reasons, we cannot use that. But it does mean that we know how many people we miss with this. So the enumerators will have pads, and they will talk to people and use a geolocation. So it'll longitude, latitude. It'll pinpoint where that person tends to camp out if they are on the streets. So they can find those folks and give them quote an address for the database. They were going to do mobile questionnaire assistance, and that's up in the air right now, but these were going to be mobile vans with a couple of Census Bureau employees, a couple of tablets where they could go through and help people work through the forms. And these were going to be used in congregate meal sites and things like that. Right now that's on hold. We don't know where we're going to go with that. And I know that this slide says apply for a job. They are still hiring, although I've seen rumblings about people who had been hired to be enumerators starting in May saying, we better look for a new job. I don't think anything official has gone out to any of those folks. As far as the official stance is, they're still hiring people to do this work. And we've been encouraging people to apply because the best way to convince people to fill out this form is for a trusted voice or somebody everybody knows, the homeless leader to talk about it and to allay fears because it's coming from a voice of authority. We want like people talking to like people. They have been behind on hiring, that being said, and again, COVID-19 really changes a lot of things. So again, ask questions. All right, the slide I've been talking about. Coronavirus. For the majority of us, this is an opportunity for us to push people online and to the phone. The homeless population is a little bit different because they're hard to find. The Census Bureau is currently trying to figure out how to change this plan because the plan has been to send these people out in enumerator pairs. And I've always questioned how effective that was going to be. If government spooks walk up to people who are living on the streets and I just don't see that that's an effective way to break through those barriers and take them and somebody to talk to them. That being said, they need to retool this right now because they're concerned about the health and safety of not only the people that they're enumerating, but also the Census Bureau workers. Their current working plan is to contact homeless shelters and points of service and see if those points of service can fill out paperwork for the people that they have served over this time period. when I get more information about that, I will send it to Caroline and see if and have her disseminate that information, because nothing has been decided yet. It is really fluid and very up in the air. How we're handling this everywhere else is pushing people to self-respond. The Census Bureau may be changing their plan, and there's talk about extending the self-response period. I don't know if it's necessarily extending the self-response period, or it's not starting the knock-door non-response follow-up phase when it's supposed to be. They've already postponed the early non-response follow-up visits that were supposed to start in about 3 weeks. Yeah, April 9th. Those have already been pushed back to April 23rd. But again, we don't know where we're going to be come April 15th, let alone May 4th. So all of this is really in flux. So if we can reach out to points of service for homeless populations and have them fill out the forms on behalf of their customers and clients, that might be one of the best ways for us to get a more accurate count of this population. Okay, what else is being done? The Census Bureau has partnership specialists across the country, and they have been partnering with nonprofits across the country. We are one of them. The partnership specialists are supposed to be the conduits for the Census Bureau to engage with these nonprofits and give them information and have it be a two-way street, because they're having trouble hiring, and now with everything else that's happening in the world, sometimes that works and sometimes it doesn't. But they are out there, and there are ways to reach them. There are regional offices across the country. Los Angeles, Denver, Chicago, Atlanta, Pennsylvania, and New York are all hubs. And there's contact information available. Before we send these slides out, I can flip those slides, individual slides back in so people can find them. So if you want to reach out to a Census Bureau employee and say, hey, I have access to a large homeless population, how can we help get them counted? You can do that. We've heard rumors that the Census Bureau has not been great about answering the phones, particularly in the Chicago office. So there's another way to reach the Bureau to have those conversations, which would be the complete count committees. So this is probably one of my favorite programs that the Census Bureau does, in part because it reminds me of our tripartite boards where they have elected officials, people they serve, and nonprofit staff on the board. So the complete count committees are, most states have a statewide complete count committee where all of the moving statewide players are talking about how to do a complete count in their state. But there are also local ones. So each county, for the most part, they're trying to establish one of these committees in each county. And it's the town mayor. I was in Knoxville, Tennessee almost a year ago, and they had a complete count committee where they were talking to the mayor, they had all the nonprofits on board, they had the local PTA, and they were having meetings about how to do this complete count. And one of the things that they were asking the mayor the week after I was there was to ensure that police departments didn't do homeless sweeps during that March 30th, 31st, and April 1st enumeration period. Probably is still a good ask, to be honest, for a variety of reasons. But these local complete count committees are tied into the census. Most of them have a census representative at all of their meetings. But if not, all of them have contact information on this website at the bottom of this slide. So you can find the complete count committee in Knoxville, Tennessee, and you'll come up with a name, a phone number, and an email address. So you can reach out to them and say, hey, we have access to a homeless population. We'd like to help. How can we do that? Can you connect me to the Census Bureau, or do you have a plan that I can help with in some way, shape, or form? We are also a part of something called the Census Counts 2020 Coalition. It's a virtual who's who of America. They've tried to build a very diverse coalition that will touch every facet of American life. So we're talking about faith and public life. We're talking to clergy. We're talking to synagogues and rabbis. And we're talking to mosques. And we're talking to pastors and preachers. In fact, they're having a census sermon weekend coming up. NALEO is the National Association of Latino Elected and Appointed Officials. They've been driving all of the research for Hispanic communities, and they've been driving in-language materials in Spanish, and they spearheaded the fight against the citizenship question. The National Urban League and Change of Color are rallying African American communities. The Coalition on Human Needs and the Community Action Partnership are working with service providers as well as the ARC. Native Americans, Arab Americans, Asian Americans, they really tried to pull everyone in to make sure that there were resources available. And what we do as a coalition is bounce ideas off each other. We are co-branding. We are funneling messaging, especially now around COVID. We are talking about what our unified message is as a team to amplify that message, which again is right now self-response. Everyone needs to go online or call these phone lines to do their census forms. So it's been a sharing of the burden in a lot of ways and a resource for everybody. So the partnership specialists from the Census Bureau, as I mentioned, can help agencies engage with the census. They should be able to help train if you need it. They also have pamphlets and flyers and giveaways, chum. Again, that may change with COVID-19. And our coalition members are doing work all across the country, and there's a list here of the state hubs and where things are happening and who's spearheading those efforts in that state. So you can reach out and plug into the work that's already being done. We have spent the last year trying to educate and increase awareness and mobilize our networks to act. We have generated lots and lots of resources. They all have the Huggy Heart, if that's our logo down in the bottom right-hand corner. They all do have the Huggy Heart because it's well known among our population. But we have flyers and postcards and handouts. We have all kinds of fact sheets and coloring pages for kids available on our website, and all of these training materials. So if the Census Bureau can't come through and train staff right now, you could do it through our website, because we have posted short videos explaining the ABCs of the census and much more intense, longer videos, usually of me talking. But we're trying to make sure that it's easy for people to do this. We want it to be seamless. We want to make it effortless for people to engage in some of this stuff while they're doing other things. We also do have a 10-member working group that's been our sounding board, and they are in the 10 states with the highest hard-to-count populations in the country. Our website that I just referenced, communityactionpartnership.com/census-2020. We pretty much update this every day or two these days, so check back for resources. It also has our contact information that's in this slide deck as well, so if you have questions or need something, you can reach out and ask. All right, hopefully I'll be done in a couple minutes so we can ask questions and answer them. What can you do? We have tried to make it very easy for people to get information, train their staff and colleagues, and then make this seamless and have it be just part of an everyday interaction with a customer. COVID-19 is going to change how you interact with your clients, but we are trying to make it easy. If we can send you postcards, ask us. We very well might be able to do that. We're trying to work out a supply chain right now with our printers. But our webinars and our videos, good starting point for that. If you can set up in a homeless shelter a hotline, a phone or a tablet where people can go and sit on the phone and talk to a Census Bureau employee to de-enumerated, you can do that. A question I anticipate is how, if you don't have an address because you're homeless, do you fill out the census form? And it's using intersections. You know, if you're usually sleeping under a bridge at Main and First, well, that becomes your address in the file. And again, we have those posters, and we're happy to create something. If you need a form or a flyer that we haven't figured out yet, chances are pretty good that somebody else in our network does, and we're happy to create that for you. Right messaging is key. Again, slide that interaction about the census into contact with existing customers. The best thing that you can tell somebody overall, that right messaging, is that filling out the census helps your community. and community means different things to different people, but that's a very powerful message that really helps people figure out that this is something that they can participate in. Oh, 7 touches. We're asking our agencies to try to figure out how to do 7 touches with their customers, which could mean a poster in the front hall, a button that says ask me about the census on every staff member, a visibility day where on April 1st every staff person wears red and one of these buttons, which we have and we can send you, handing a flyer, doing a mailer, however you can communicate with your client base. Where 7 touches is the marketing tools, the marketing meme, or if you see a commercial 7 times, you get a pamphlet in the mail about a congressional candidate 7 times, things are more likely to sink in. So that's where that 7 touch comes from. We also have these training tools. We have now 15 different videos. The top left-hand corner one is about 7 minutes long. It's a good primer. If you can do nothing else but show everyone in your office one 7-minute video, this is what you do. If you've got 20 minutes, you can do our very short staff 20-minute, I think it's got 23 slides, and it's just me talking about the basics of the census. And then we have these short 14 videos that are all under 2 minutes to talk about how it's safe and easy, how you count everyone in your household, things like that are commonly asked questions to make sure that people know that it's safe and easy. If you have a CCTV in your office, you could play one of these that's most relevant for your population. I've already mentioned this, and I want to make sure we have time for questions. So again, that community resource is really crucial, and we will be sending these out so you can read this. There is, the full research is available, and I put the hyperlink in here so you can go read it. They did research on kids. They did research on African Americans, Asian Americans, Native Americans, and Hispanic Latino populations to talk about messaging and how different messages impacted each community. So we have a little bit more drilled down than just this, but these are the most salient points, is that resources your community needs depend on this. Data from the census can only be used in those funding formulas, and then it lasts for a decade. Common questions and answers. I'm going to just flip through these. You do participate if you're not a citizen. Do they come to my house? This is more relevant for people with homes, obviously, but COVID-19 will change this. In general, they will not come to your house unless there is a question or you do not fill out the form. If they need a follow-up, but they're going to start doing those follow-ups by phone. So it's a little convoluted now, but in general, if you want to avoid somebody coming to your home, you fill out the census completely and early, and then they won't. Is it safe for me to provide my information? I have not touched on this at all yet, and I don't see any questions, so I'm going to indulge a little bit. The safety protocols are threefold. First of all, the Census Bureau changed a lot of their laws in the 1970s to put new strict rules in place to protect privacy. Census data can only be used for statistical purposes. They can only use that information in aggregate, period, full stop. They cannot share it with other entities. They get information from Homeland Security. They get information from HUD and HHS. It's a repository of information. They do not, and they are in fact prohibited by law from sending that information out into the field. So that information doesn't go anywhere unless it's an aggregate. So they could talk about the homeless population tends to be ages da-da-da-da-da-da. But they can't say Joe Smith, who's homeless in Denver, Colorado, is 47. That doesn't happen. That personal census information eventually is disclosed. If you're a genealogy researcher, that's good news for you. The next release will be in 2022, and that's when the forms from 1950 will be released. And when I think about that, my grandfather filled that form out for the household back in 1950. My uncle wasn't born yet, so it's just my grandmother, my mom, and my aunt, and my grandfather on that form. That's really cool, but my grandfather has passed away already. My uncle has been, he wasn't on that form, but he has been born and he died in that 72-year period. So people who are nervous that they might lose their housing, or if they're housing insecure, or they're on Section 8 housing vouchers and they really worry about filling out that form completely, you can fill out that form because the landlord that you're currently living with will not know that you have 8 people in a house that's meant for 6. until the year 2092, when in all likelihood that landlord will be dead. So that is a security precaution. And then Census Bureau staff, on their first day on the job, all pledge an oath to something called Title 13, which stipulates that if you reveal private information that you learn on the job during your tenure at the Census Bureau or ever, so this is a lifelong oath, if you reveal private information about a single individual, you can be jailed for up to 5 years and or fined up to $250,000. So it is, there's safety precautions that are in place to make sure that this is safe for people to provide information. Can I help someone fill out their census form? Yes, please. Most of us who are in the service provider industry when it comes to anti-poverty programs help people fill out forms on a daily basis. You can certainly help somebody fill out this form. What you cannot do is fill out forms on behalf of somebody without them knowing, which you wouldn't do anyway. You're not going to go into your database and go through all the 15 people that you think will never talk to a Census Bureau employee, will never fill out the form. You are not allowed to go online and fill those forms out for them. You are able, encouraged, and allowed to assist people in filling out these forms so they can complete the census. Accessibility issues, the Census Bureau has things in Braille. One of the hotlines is for the hard of hearing. They also, the American, I'm going to get it wrong, but the American Disabilities Association has a wide variety of toolkits. They have lots of resources in third grade English level language, so they've also thought through some other stuff. So there are ways to handle accessibility issues for sure. We have social media. We encourage you to participate with us. These are our resources. We're going to send this out. I'm going to leave it on this slide. I am Lindsay Marsh, so that is my email address up at the top. Lauren Martin is also on the call with us today presenting, so she can help me answer some questions. And some of you may know Lil Dupree. She's with the Community Action for a while. She's on our team as well. And then we have subject matter experts out in the field in California. Please do email me additional questions, and I'm going to answer. Can somebody read me Elena's question, because it is not popping up for me.
Yeah, I'm trying to. Yeah, this is Darlene. I'm trying to read it. I'm trying to click it to expand, because I see one question that came up here in our local continuum of care, but I cannot see the rest of it. Caroline, can you find a way for me to see the whole question, because I cannot see the entire question from Elena.
I can see it. This is Lauren Martin. I can see the question. They're asking about how people in hotels and motels will be counted, Lindsay?
Oh, sure. Yes. So that's part of the, it's called transitory location process. And this is, I just mentioned that homeless populations were going to be counted this way, but it is also people who live in RVs, people who live in motels and hotels. It's all that March 30th, March 31st, and April 1 period. So I know that right now, because of COVID-19, the Census Bureau has been reaching out to all of these places where they would normally be going to enumerate, to ask the people who facilitate those facilities, administer those facilities, to give them written records of the people who are staying with them. So hotels and motels fall into that category that will be counted, but it's currently up in flux how that process will work. Thank you. Excellent question. Are there more questions? I can't have answered everything.
I have a question. You mentioned when you were talking about the different populations that were being counted, and you were saying incarcerated populations. And do they count them based on where they are currently serving their sentence, or in their hometown? How does that go?
Yeah. There are some groups that are fighting to change this, because people who are incarcerated in a federal penitentiary are counted in the county where they're serving. So I know I keep using Colorado as an example, but I know it pretty well. So Canyon City is a small little town just outside Colorado Springs that has a federal penitentiary, and all of their federal money comes from that prison population. So this is twofold in disenfranchisement. because it means that the hometowns of these incarcerated individuals they don't receive the federal funding, but they also don't receive the political representation. So you have Congress people who represent jails where the inmates can't vote. It's a real inequality, but that is jails, like if you're thrown in a drunk tank for a couple of hours, you won't get counted in jail. But the same is for like a long-term rehabilitation facility. If you are in drug rehab, or those folks will be counted by the administration of the facility in the group quarters enumeration. Domestic violence shelters, some homeless shelters were counted in group enumeration in February. And I don't know what differentiates that from the transitory location enumeration that happens at the end of that's supposed to happen at the end of the month.
Okay, great, thank you. We have
You're very
another
welcome.
question. I'm trying to see again. I don't know if I'm not doing this correctly. Lauren, can you see that last question?
Yes. So the second question is, I just wanted to clarify when you said a homeless person is counted, they are counted where they are on the street. Can you clarify that?
Sure. So the plan has been for these pairs of Census Bureau enumerators to go out with data-enabled iPads, essentially. And what they'll do is go and they'll encounter somebody living on the streets, and they will ask them questions to try to get a name and a date of birth. And they will physically geotag it, and the system will connect to GPS and will tag that person, that homeless person, with a longitude and a latitude, which will then become their address. So that's how that works. But if it's somebody who comes into a facility, they can say, oh, I usually stay at the corner of First and Main, and the First and Main intersection will become their address. I'll see if I can find some examples to send out with the slide deck and give that some more clarification on how that process works.
So could they come in, say for example, if they come into Healthcare for the Homeless Health Center, and the person helps them get online or goes on the phone to help them, a case manager or a social worker to help them, or community health workers, could they use, and they're currently just on the street or in an encampment, could they use the address of the health center, or would they use the address where their encampment, where that street where their encampment is currently located? I believe
they would prefer the encampment.
Okay.
But that being said, whomever, there should be guidance when you fill out the form as to how to do that. And my guess is that no one is 15 miles away from where they're staying when they come into a service provider. So it's the same. It's not a big deal if they want to use the address of the service provider versus where they've been encamped. I think it's not necessarily a big deal one way or another. The important thing is to get them counted.
Right. Okay. Great. Thank you. And we have a couple of more minutes. Are there any more questions from our audience? I don't see any more questions. Are there any final parting instructions or hints, Lauren, Lindsay, you would like to share before we sign off?
I'm grateful there are no questions. That means I covered things well and I didn't leave things hanging. But please do feel free to reach out to me, and any way that we can assist you with making sure that there is as complete account as we can get is appreciated, and we are here to help. So please do reach out. I see a question being typed, but I can't see it.
Yeah, I can't. Okay. Oh, yes. I'm sorry. Before we sign off, there's a reminder. Please fill out the evaluation that will pop up at the end of the presentation. That gives us an idea of how we have met your needs, your educational needs, as well as helping us plan future educational opportunities. So please don't forget to fill out the evaluation that will pop up at the end of this webinar. And at this point, I believe that we have answered all questions and given the information. Please contact Lindsay at the information that is on the screen currently. And also, if you have any additional questions, please reach out to the Council, the National Healthcare for the Homeless Council. We're also here to serve you, and we will connect you with any of the resources that are needed. And with that, I think we can say good afternoon and thank you for joining us. Goodbye.
Thank you very much.
Mm-hmm.